You take a pill for a headache without thinking twice. You reach for a bandage without wondering if the wound will kill you. You trust that if something goes seriously wrong inside your body, someone with training and tools will know exactly what to do. Now take all of that away. No hospitals, no antibiotics, no trained doctors, no pharmacy down the street. How did anyone survive long enough to become your ancestor? Here's a fact that should stop you cold. Archaeologists have found 7,000-year-old human skulls with a hole deliberately drilled straight through the bone. No anesthesia, no sterile tools, no understanding of the brain the way modern surgeons have it. And yet, the bone around that hole shows something you wouldn't expect. It healed. The patient lived. Stick around, because by the end of this video, you'll understand exactly how that was possible and why some of the treatments your own doctor prescribes you today trace directly back to remedies your ancestors were using tens of thousands of years before medical school existed. The answer isn't what most people assume. It wasn't constant, hopeless death at the first sign of illness. It was something far more resourceful, and in some cases, far more effective than you'd expect from a species with no modern science at all. Consider the scale of the problem your ancestors faced. No microscopes to see the organisms causing infection. No understanding of how blood carries oxygen or how organs actually function. No written records to pass detailed knowledge forward with any precision. Every single piece of medical understanding had to survive inside memory, ritual, and verbal instruction, generation after generation, with no guarantee it would ever reach the next person who needed it. And yet, somehow, entire systems of effective care took shape anyway. Start with the biggest myth first, because it's almost certainly the one sitting in your head right now. Popular imagination pictures prehistoric humans dropping dead from every infection, every broken bone, every fever, doomed the moment anything went seriously wrong. But the archaeological record tells a completely different story, and the proof is written directly into ancient bone. Skeletal remains from Neanderthal sites, studied extensively by paleoanthropologists including Eric Trinkhaus, show individuals who survived severe injuries, missing limbs, crushed bones, and blindness, sometimes for years afterward. Think about what that actually means. A blind person or someone missing a limb cannot hunt, cannot forage, cannot defend themselves. Someone had to feed them, protect them, and treat wounds that should have killed them within days. That kind of survival wasn't luck. It was care, deliberate and sustained, and it's direct physical evidence of something researchers now call prehistoric caregiving, evidence that rewrites the entire assumption that ancient life was a solo fight against death. So if it wasn't hopeless, what actually counted as medicine before medicine existed as a formal concept? The first and most basic form of ancient healthcare was observation, and it's more powerful than you'd think. Prehistoric humans didn't have germ theory, the modern understanding that many diseases are caused by microscopic organisms, but they didn't need the theory to notice patterns. If a wound was cleaned and kept away from dirt, it healed better. If certain plants reduced swelling, people remembered which plants those were and used them again. Get enough of these small observations stacked across enough generations, and you end up with something that starts to look suspiciously like real medicine built without a single textbook. And some of what they discovered is still sitting in your medicine cabinet right now, whether you realize it or not. Plants were the foundation of almost everything. Willow bark, harvested from willow trees, contains a compound called salicin, which the human body converts into salicylic acid, a natural pain and fever reducer. Multiple ancient cultures independently discovered its effects, from indigenous groups in North America to communities across Europe and Asia. Long before chemists in the 19th century isolated and refined that same compound into what you now know as aspirin. That's not a coincidence. It's evidence that ancient humans were running actual medical experiments, just without laboratories, using their own bodies and careful observation as the testing ground. Honey shows up constantly in the archaeological and historical record of wound care, and for good reason. Honey is naturally low in moisture and highly acidic, which creates an environment hostile to many bacteria, meaning it can help prevent infection when applied to an open wound. Ancient Egyptian medical texts, including the Edwin Smith Papyrus dating back roughly to 1600 BCE, describe honey being used specifically for this purpose. Long before anyone understood why it worked at a microbial level, people had already figured out that it did. But willow bark and honey are almost tame compared to what's coming next, because the next remedy on this list sounds less like ancient medicine and more like a horror movie, and it still gets used in hospitals today. Maggots present exactly that example, one of the strangest but most effective pieces of ancient medical knowledge ever discovered. Left on a wound under the right conditions, fly larvae will consume dead and infected tissue while leaving healthy tissue alone, essentially performing a natural, self-directed cleaning of the injury. Historical records describe military surgeons noticing this phenomenon on battlefields for centuries, and modern medicine has actually revived the practice in specific, controlled settings, a treatment now called maggot debridement therapy. Something ancient healers stumbled into through direct observation is still used in hospitals today, just with far more precise, sterile control. Now here's where the picture gets even more remarkable. Archaeologists have discovered prehistoric skulls, some dating back roughly 7,000 years, showing clear evidence of trepanation, a surgical procedure involving drilling or scraping a hole into the skull. What makes this discovery so striking isn't just that ancient humans attempted it. It's that many of these skulls show clear signs of bone healing around the hole, meaning the patient survived the procedure, sometimes for years afterward. No anesthesia, no sterile tools, no understanding of brain anatomy the way modern neurosurgeons have it. And yet, somehow, a meaningful number of patients lived. Why would anyone attempt something this drastic? Researchers studying trepanation across multiple ancient cultures, from Peru to parts of Europe, suggest it was likely used to relieve pressure from head injuries, treat severe headaches, or address what ancient communities may have interpreted as spiritual afflictions. Whatever the original reasoning, the survival rates found in some archaeological samples, sometimes estimated at well over 50% based on healed bone evidence, suggest this wasn't reckless guesswork. It was a genuine, repeated medical practice, refined enough over time that people kept surviving it. In parts of ancient Peru, archaeologists studying skulls from different time periods have found that survival rates for trepanation actually improved over centuries, moving from roughly 40% survival in earlier samples to well over 80% in later ones, based on bioarchaeological research led by researchers including John Verano. That improvement over time is one of the clearest signs available that this wasn't random trial and error repeated blindly. Someone was refining technique, tool design, and likely wound care methods across many generations, effectively running a centuries-long medical training program with no written textbook guiding it, only observation and inherited practice passed from healer to healer. Beyond the plants and procedures, there was another entire category of ancient medicine that's easy to overlook: behavior itself. Long before anyone understood contagion, the process by which disease spreads from one person to another, many ancient and traditional societies developed customs that function almost exactly like modern quarantine, isolating the severely sick, avoiding certain water sources during outbreaks, or separating a community after unexplained deaths shows up across a wide range of documented traditional cultures. They didn't need the germ theory to arrive at behaviors that limited the spread of illness. They needed only careful, repeated observation of what happened when those precautions were ignored. This kind of behavioral medicine extended into diet and daily habit as well. Many traditional societies developed specific taboos around food preparation, water sourcing, and handling the dead. Practices anthropologists studying disease ecology have noted often align surprisingly well with actual disease transmission risks, even though the communities themselves had no biological explanation for why the rule existed. A taboo framed as spiritual or ancestral could, in practice, function as an extremely effective piece of public health guidance, simply dressed in the cultural language available at the time. Childbirth deserves its own moment here because it represented one of the most dangerous moments in ancient life, and also one of the most carefully managed. Anthropological studies of small-scale societies consistently describe experienced women, often grandmothers or established community elders, serving as the primary caregivers during birth, accumulating detailed, practical knowledge passed down verbally across generations. This wasn't guesswork. It was an early form of specialized medical expertise, concentrated in specific, trusted individuals within the group, functioning in a way that's not entirely different from how modern midwifery still operates today. These caregivers understood things that took modern medicine centuries to formally document, such as which positions eased a difficult labor, which herbs could help manage bleeding afterward, and how to recognize the early warning signs of complications before they became fatal. None of this knowledge came from textbooks. It came from decades of direct experience, repeated across countless births, refined and passed forward through mentorship rather than formal study. The specific plants and techniques varied enormously between regions and cultures, but the underlying method, careful observation combined with mentorship from experienced elders, showed up again and again across entirely unconnected societies around the world. Let's talk about something that connects directly back to you, because this is where the story stops being purely historical. A huge percentage of modern pharmaceuticals were either discovered directly from plants or inspired by compounds first identified in traditional and ancient medicine. Aspirin from willow bark, morphine from the opium poppy, a plant used for pain relief since at least ancient Sumerian civilization. Quinine, used to treat malaria, first identified through indigenous knowledge in South America regarding the bark of the cinchona tree. Modern pharmaceutical research, even with all its laboratories and clinical trials, still frequently starts by asking the same question ancient humans were already asking tens of thousands of years earlier. What does this plant actually do to the human body? Here's the counterintuitive twist that reframes this entire topic. You'd assume that as medical knowledge advanced through history, society would have simply built directly on top of ancient discoveries in a smooth, continuous line. Instead, enormous amounts of ancient medical knowledge were lost, dismissed, or deliberately abandoned for long stretches of history, particularly during periods when medicine became entangled with superstition, religious control, or simple cultural arrogance toward older traditions. Some plant-based remedies used effectively for thousands of years were only rediscovered and scientifically validated centuries later, essentially reinventing something ancient humans already understood through direct experience. This raises an uncomfortable but important question about how we define progress. Modern medicine is undeniably more precise, more consistent, and dramatically more effective at treating a huge range of conditions ancient humans had no defense against at all. But the underlying instinct, observing what helps the body heal and refining that knowledge over time, isn't a modern invention. It's the same instinct your ancestors were using around a fire, examining a wound, deciding which plant to apply next. None of this means ancient medicine was equal to modern medicine in outcome. Life expectancy was dramatically shorter. Infant and childbirth mortality were devastatingly high by modern standards. Infections that a simple course of antibiotics resolves today could easily prove fatal thousands of years ago. This isn't a claim that ancient healthcare was secretly superior. It's a claim that it was far more sophisticated, far more observational, and far more effective in specific documented cases than most people assume. There's also something worth sitting with about why this myth of helpless, medicineless suffering became so dominant in the first place. Part of it comes from a very natural bias in how history gets told. Failures leave dramatic evidence. A skeleton with an untreated fatal wound tells an obvious story, but success is quieter. A person who survived an infection because of a well-timed poultice, or a child who recovered from fever because an elder recognized the early signs and intervened, simply goes on living an ordinary life, leaving far less dramatic evidence behind for archaeologists to find centuries later. The successes of ancient medicine are, in a strange way, invisible by design, hidden inside every ordinary life that continued instead of ending. So the next time you take a pill without a second thought, or apply a bandage without wondering if the wound will kill you, remember that the instinct behind that action, watching, learning, and adapting to keep the body alive, is exactly what allowed your ancestors to survive long enough for you to exist at all. You take a pill for a headache without thinking twice. They took bark from a tree, and somehow, across thousands of years and countless generations, they were right.